Hello and welcome to Long COVID Foundation podcast. At the Long COVID Foundation, our vision is to improve health and well-being of long COVID sufferers by contributing to long COVID diseases understanding and treatment options. And to do this, we work with organizations and individuals of medical professions, scientists and researchers, as well as long COVID interest groups to promote awareness of long-standing symptoms, health and rehabilitation challenges. And this is the channel where we share educational information on long COVID to help you understand your symptoms better. So if you're new to the channel, please make sure you hit subscribe button because I can help you to get answers relevant to your symptoms. Thank you, and let's jump into today's interview. And today I would like to welcome Rachel Jessey. Rachel is registered naturopathic nutritionist and founder of Be Nourished. It's a UK-based nutrition consultancy agency leading the way in personalized nutrition for supporting resistance, resilience, and recovery from chronic illness. Having enjoyed 12 years of clinical experience, she has gained extensive knowledge in nutrition and integrative healthcare space, and she works with clients both nationally and internationally. Rachel has been researching and working exclusively on long COVID for the past 2 years and helps her patients to identify the root cause of disease process and develops personalized nutrition and lifestyle protocols to support recovery. Rachel also attended 4th Long COVID Coalition Congress, where she has presented the potential impact of tryptophan metabolism via the Kynurenine pathway in COVID-19 and long-haul COVID patients, which has received great attention from public, I should say. So Rachel, welcome to our channel. It's a great honor to have you on our channel.
Thank you so much for having me to share my clinical insight. Hopefully some people will find what I present today useful and helpful going forward.
Absolutely. Thank you for coming, and I know you have some slides to share with us today. So without any delay, I would like to pass the stage to you. So please share your screen.
Thank you, everyone. Hello, and thank you so much today for having me here to talk. So I'm going to talk you through my clinical experience of working with patients during the COVID-19 pandemic. So my particular focus has been on supporting patients with their symptoms of long COVID. Since I saw my first client, it was around April 2020, I started seeing people coming through. So how I fit into this picture is really about bringing people back to basics with regards to nutrition and lifestyle interventions, because we've had over 2 years now of people trying off-the-shelf protocols, and some of these have been really effective for people, but equally some have been detrimental. So for me, this has really solidified what I've been working on along this whole kind of process, that the concept of personalization is really important. And what I'm finding is that, although there's people that are presenting with similar kind of findings in testing, they're also presenting with slightly different symptoms. And what I like to do is track back through a client's timeline to find exactly, what the root cause is and why they're actually suffering with the long-term effects of COVID. So what we will talk about today, what I'm going to cover, is some of the benefits of personalised intervention. Then I will talk about my roadmap to wellness and why my main focus is on the gut microbiome. And then we're going to look at some helpful tests in clinical practice and also talk you through some case studies. So depending on how much time we have, I will hopefully get to present quite a few case studies to you so you can have a look at what I've been doing. So first up, let's have a look at the benefits of personalization. So when we talk about personalization, we're looking at individual biochemistry, we're looking at people's timeline history, we're looking at their health profile, and also I'll go into looking potentially at epigenetic factors as well. And what that means is that interventions can then be tailored to that individual biochemistry. It's going to prevent the use of inappropriate supplementation, because what I'm finding as well is that some people have been taking certain supplementations for quite a long time, and that could be potentially knocking out other nutrients. So for instance, if you've been taking zinc for a long time, high doses, you could be knocking out things like iron and copper and other nutrients. It's also going to protect the patient from drug-nutrient interactions. So again, there's this concept that taking a supplement is safe or taking a herbal formula is safe, but actually if you're taking medication, there needs to be careful consideration with regards to that, because some supplements, even foods, can interact with certain medications, particularly blood pressure medications and things like warfarin. And it also takes into consideration things like physical, mental, spiritual well-being, and also accounts for things like social determinants, ethnicity, and religious beliefs. So you can really get that personalization from that aspect. It can be safely used along medical intervention. So I do have lots of patients that are taking medications, and just making sure that you carefully plan their protocols around that can be quite effective. It can help to also pinpoint a root cause. So sometimes people are coming to me with long COVID symptoms, but actually it's related to things that have happened previously in their timeline that has just reduced their resistance and resilience to disease, which I'm looking at improving. So how I start, or the main goals that I'm trying to achieve when supporting my patients, is to encourage what I refer to as immune resilience or immune tolerance. So I don't want to be boosting the immune system. I don't want to be suppressing it. I'm looking really to generate balance. And I look to address things such as risk factors, bringing down inflammation, and addressing oxidative stress. And to achieve this, I use this particular model, which coincidentally, I designed this prior to the pandemic, because I was seeing patients with chronic fatigue and post-sepsis syndrome prior to long COVID. And so I was able to adapt this model quite nicely for my long haul patients as well. So this model shows the specific areas that I address with my patients' health. So I'm looking at optimizing nutrition and hydration. I might perform a nutritional analysis to identify any immediate deficits with dietary intake. And then I look at metabolic flexibility. So I'm looking at things like blood sugar, sleep, circadian rhythms, menstrual cycles, inflammation markers, stress adaptation, but we might even look at things like cardiovascular and kidney function as well. And then I will always consider microbiome harmony. So I'll cover this in a bit more detail in my future slides. But this is important because many people recovering from long haul illness tend to have a certain gut microbiome, and I'm finding that really interesting. And also I will talk my long haul patients through things like physical exercise and mental well-being, because they're also two important aspects to the overall interventions that we need to put in play. Now, with regards to physical fitness, as patients start to recover, the temptation is to then go into overexertion and kind of do all the things that they used to do, and that can actually result in a little bit of a relapse. So it's important to educate my patients on taking it easy, taking exercise slowly, and we work out a protocol where we can introduce exercise gradually. And also now there's quite a lot of personal trainers who are now specialized in long haul or COVID recovery fitness training. So then I will look at mental well-being. So I'm encouraging things like nurturing connections, spending time in nature, encouraging breath work, grounding. And I'm also finding that things like cold showers and cold water exposure is being really helpful. But above all this, the main thing that I'm looking to find out is what's actually happened in a person's timeline to make them vulnerable. And so I wanted to show you this case because this is how I tend to organize my patients' timeline. So once I've kind of visited with them and consulted with them, got their health history all recorded, I will organize it in this, what I call the functional matrix. So this case refers to a 43-year-old man, previously healthy. He contracted COVID this year and has developed long COVID and has quite severe symptoms. So I've only just taken him on, but I wanted to share this because it was really interesting. So he's currently suffering with depression, constant anxiety, post-exertion malaise, sleep disturbances, dizziness, panic attack, and also muscle aches. And he's actually not working at the moment, so his symptoms are actually quite severe. Now, of course, what I could do is look at these symptoms and treat these symptoms, with general therapies. But I like to take a deeper dive in the case history to see if there's anything that's kind of popping out that I think, well, what could we really work on, and what is the first area that we need to start addressing? And as you can see here, so I've got here, I call them the antecedents, triggers and mediators. And you can see in the triggers section here, he had his adenoids and tonsils removed when he was younger, and he also needed a lot of antibiotics as a child. So it's interesting that already quite early on in his timeline, he potentially had this disrupted microbiome going on. But the actual other thing that really, really pricked my ears up and kind of got me on a path of research here was that he's actually been using proton pump inhibitors for 20 years. Now, long-term proton pump inhibitor use is generally not recommended because not only do PPIs increase the risk of developing nutritional deficiencies such as B vitamins and magnesium, which incidentally vitamin B deficiency and magnesium deficiency can result in all of these symptoms, but PPI use has been correlated with worse outcomes in COVID-19, but also contributes to gut dysbiosis. So for me, for this particular client, I'm focusing on gut microbiome to start with. So what I've started to do with this patient is we've ordered gut testing so that we can assess his overall gut function. And I'm working with his GP to reduce medications. And I'm going to be supporting his diet and lifestyle with supplements because when you've been on PPIs for that long, you're at risk then of rebound reflux. So we need to be supporting this patient. So from my perspective, if we can remove the PPI, we can start to address digestion and absorption, and that's the kind of the first foundational level that I would work on with this client, and I'm convinced that we will see quite marked improvements. So hopefully I'll be able to come back and update you on this particular case. But yeah, I thought that was really interesting because this is about looking at someone's timeline prior to them actually getting ill and contracting long COVID. So with regards to what I call microbiome harmony, I work in a specific way. So I've been doing a lot of research anyway on the gut microbiome because I find it such a fascinating subject. And really, wherever there's a mucous membrane, there's a unique and diverse set of microbes, and they all interact symbiotically together. And what these microbes help with is providing us with our first line of defense against foreign invaders. And there is a microbiome, a unique microbiome within the nose, within the mouth, the throat, the lungs, the stomach, the gut, but also in the urinary system and the reproductive tract. And what's been really exciting to discover over the last couple of years is that these individual microbiomes have a bi-directional communication with each other. So they're all working together and they help to protect us from overactivation of the immune system. They help to mitigate the effects of cytokine storm. They communicate with the brain, they communicate with the kidney, they're communicating with the lung function to support us while we're going through periods of illness. So it really makes sense to me to focus on these areas as a target to improve someone's resistance and resilience, not only from long COVID, but also to prevent future infection. So in my particular model, I focus on the nasal, the oral, the gut and the lung microbiomes because these are particularly relevant to COVID-19. And there's a number of ways in which we can support each of the microbiomes. So as a given, I always ask people about their oral health and their oral hygiene because we know through research that certain microbes within the oral cavity can actually be found in heart disease and in Alzheimer's. So there is definitely that cross communication of microbes from the oral cavity. locating elsewhere in the body. So we're going to be looking at things like effective flossing and brushing. Addressing the diet is going to help. We're going to be looking at regular dental checks, and also I will use things like natural antiseptics, or things like oil pulling can be really helpful for keeping the mouth nice and clean. And then with regards to the nasal cavity, if someone's coming to me with, sinus issues, we would potentially look at sinus washes, we'd look at steam inhalation, antiseptic nasal sprays can be used, and things like povidone iodine and hydrogen peroxide spray I've used a number of times with some good effects. And then with regards to the gut microbiome, of course, you can use diet, you can use supplementation, but also just addressing things like the nasal and the oral health can be really important. And I'll talk you through a case where I actually did focus on oral hygiene, and it really triggered off some great healing responses in my patients' recovery. So yeah, addressing all of those microbiomes can have an effect. And then when we're looking at supporting the lung microbiome, yes, you can use things like herbs and supplements to break down any mucus that could be trapped there, and bring down any inflammation within the lung, and using things like steam inhalation. But also, again, addressing the gut, addressing the oral and nasal cavity can help with the lung microbiome as well. And of course, I love to run microbiome testing. So I'm seeing a few patterns emerging. It's becoming clear through the microbiome research that there seems to be this distinct gut microbiome forming in response to SARS-CoV-2 infection. And nearly all of my tested clients are showing suboptimal butyrate producing species, suboptimal commensals such as bifidobacteria and lactobacillus, and also many of them are coming back with little to no akkermansia. And what's really interesting to me is because these short chain fatty acid producers, these butyrate producers, are really important because they are the kind of microbes that will communicate with the lung and communicate with the brain axis. So it's interesting that those are being knocked down in COVID-19. So quickly, some examples of some of the testing that I'm using, which I'm going to walk you through now. So I work closely with a company called BioSite. They offer very basic microbiome testing. But the reason I chose to work with this particular company is because they're currently running a clinical trial with COVID-19 users, and they're testing the gut microbiome before and after treatment, and measuring that against symptoms. So they're using the 16S DNA sequencing, which is quite a nice way to measure the gut microbiome. And as you can see, there's 3 different samples here from 3 different patients, and they're showing, a pattern of low short chain fatty acid production, low bifidobacterium, low lactobacillus, and low akkermansia. So it seems to be this common feature coming through. Now, the pros with this test is it's very cost effective. It's one of the most cost effective tests on the market. It's quick and easy to perform. It's also looking at toxin and neurotransmitter producers, detoxification enzymes, vitamin synthesis, and also lactose and oxalate intolerance. And the results are usually back within 2 to 3 weeks. And the cons are, and this is across the board with most gut microbiome tests, is that they are just a snapshot of the gut microbiome at one particular moment in time. So it's always important to take the results in the context of the overall picture that the client is presenting with. And it doesn't assess all of the markers that I would like to see. So it's not looking at parasites or yeasts or molds. It doesn't look at bile acids and pancreatic enzymes or intestinal permeability markers, but nonetheless, it can be quite a useful test in a low cost bracket. And next is the Genova GI effects. So this one is a very comprehensive stool analysis. So it is looking at digestion and absorption. It's looking at inflammation and immunology markers. It's looking at the gut microbiome, so it's assessing the commensal bacteria. It's also looking at yeasts and fungus and pathogenic organisms. It's looking at additional markers such as Campylobacter, Clostridium difficile. It's also looking at things like zonulin. So it's very, very extensive, and it's using it's using different methods for testing. So it's using PCR, it's using DNA sequencing, and also mass spectrometry. So it's a very good test. It's what I would consider the gold standard of gut testing. I really like them, and they also offer SIBO testing. They have great support and educational tools. The test is relatively simple to perform with a turnaround of 2 to 3 weeks. And what I like about Genova is that their reports are really comprehensive, but they're also really easy to interpret. So I find with these particular tests that the patient is much more on board with making changes, because they can really see clear, clear markers and clear reasons why we need to address certain things within the gut. And it's excellent to help to pull together more personalised supplement and dietary interventions. And the cons are that, again, it is just a snapshot of the gut microbiome. It's relatively expensive, but Genova do offer a payment scheme on their tests, which can be quite helpful. And then there's a couple of other companies that I wanted to mention. So we have Invivo and HealthPath. So Invivo, they offer a pretty good panel, actually. They are measuring pretty much similar markers to the Genova testing, which is helpful. They have really good comprehensive reporting. So overall, I feel this is a really good panel. They also offer SIBO testing. They have a quick turnaround, and the support and education is great. The other thing that Invivo have is a good supplement range. So you can really help to tailor supplements based on their own products, which they've designed around these specific reports. And again, the cons, snapshot results again. And I've found with Invivo, they've missed some of the key markers in my clients, in particular yeast and fungal markers. But these can be missed. They're quite hard sometimes to detect in the stool. So, I'm not saying that that's a problem across the board, but I've just found it hasn't been so sensitive from that perspective. It's more expensive than Genova, and the reporting is not so easy and clear as Genova. And then with HealthPath, again, if you're going for their kind of top test, their top tier test, it's pretty similar to the Genova test. It's easy to perform. Again, they can look at SIBO testing. So it's all pretty similar markers to Invivo and Genova, a 2 to 4 week turnaround. So with HealthPath, you get online support. And you can access diet reports, supplements that have been prescribed to your specific gut health test. And there's an option to spread the cost. But with regards to their cons, their tests are much more expensive. The lab has been outsourced, and I find the reports slightly more difficult to interpret. So you can see here, the results are kind of all clumped together, and the way that the reporting is actually set out, it needs a really careful eye for interpretation. So I don't think it's an easy test to just buy off the shelf and then have the results and be able to assess them yourself. You need an experienced practitioner to take you through those. And then some other tests that I might use urinary organic acid. So they're looking at end-stage metabolites of toxin clearance, neurotransmitter function, and gut health. So that can be quite good. It also assesses mitochondrial function, that one as well. So that's a really good overall test. It's not too expensive, that one. The next one up would be metabolomics, which is really looking a little bit more deeply at those markers, and it's also a nutritional test, and it can really help to get, really target precision nutrition in patients, because it's looking how the cells are actually metabolizing vitamins and minerals, amino acids. etc. And then the kind of gold standard test would be the NutrEval, which is blood and urine. So this is looking at key vitamins, minerals, amino acids, fatty acids, digestive markers, but it's also got the organic acids in here. It's looking at fatty acid metabolism, mitochondrial function, and oxidative stress. So it's a really comprehensive panel, and I really do like to run that one if it's possible. And then I look at the 23andMe genetic testing. It's just a really nice additional add-on, because again, it can help to really personalize down these interventions. And you can see from this snapshot that I've attached here, this particular client has got a SNP on the HNMT enzyme, which is all related to histamine breakdown. So it just gives us further direction of, you know, this person will probably do well on low histamine interventions. And then I'm going to take you through some case studies. So case number one is a 42-year-old female. She had normal body composition. So she came to me with long COVID, but when we tracked through her health history, she'd had a food poisoning event 15 years prior, and this had left her with IBS and lactose intolerance. So she'd prior to kind of COVID, she'd had continuous and painful bloating. She'd reacted really badly to her vaccinations, and her natural infection had left her with extreme fatigue, a persistent cough, and low mood. So we used the in vivo GI ecologics panel, and the results were pretty unremarkable. But again, you know, pathogens were low, but the commensal bacteria were really low, and Akkermansia was coming up low. So again, this is a typical picture that I'm seeing. So I immediately put her on a personalized gut health program. We used interventions like galacto-oligosaccharides to encourage the growth and proliferation of commensals and Akkermansia. And we used polyphenol supplementation to also help with that growth and proliferation. Then once we'd kind of got her up to a nice level and addressed her bloating, I did actually go in with a probiotic supplementation, which I don't normally do as a first port of call. But it really did help her, and we had a great outcome because all of her GI symptoms had resolved, her energy returned, and she was able to participate in marathon training again. And as she continued to work through her program, her cough cleared and her mood is so much better, and she continues to do well to this day. And then my second case study, a 62-year-old female. She was slightly overweight. She had multiple food intolerances, bloating, burping, gastrointestinal discomfort. She had a white-coated tongue, which she had been diagnosed as COVID tongue. She was suffering with reflux, sinus congestion, fatigue, and she wasn't actually able to attend work or go to church. So her long COVID was actually putting her at risk of losing her job at that time when she came to see me. Now, she'd already had the health path test done when she came to see me. And again, there was nothing horrendous going on within her gut, but it was again these low commensals. She had a little bit of bile acid malabsorption going on, and a little bit of dysbiosis, which we looked to address. Now, she had very little money to focus on a supplement protocol and other testing. So we went straight in for looking at her food. We did what we could with getting her food really good quality. And this is the case where I focused on oral hygiene because we had the white-coated tongue, and I wanted to address that because I kind of suspected that might be exacerbating her gut issues. So we implemented a oral hygiene protocol. We added some nasal rinsing. We used intermittent fasting. We introduced organic food. Now, she had low oxalobacter formagens in her stool test. So those oxalobacter formagens are responsible for breaking down the oxalate in our food. So I took high oxalate foods out of the diet as well. And I used a short course of a herb called Cistus incarnus, which is a biofilm breaker, but also is antimicrobial. We use things like apple cider vinegar, digestive enzymes, and bitter foods, sorry, that's supposed to say there, to help support overall digestion. So it was a really naturopathic, gentle protocol that we used with her. But I worked with this lady for 8 weeks in total. And in that time, all of her GI symptoms resolved, her energy returned, and it was great because within 2 weeks of working with her, she was actually able to return to work and return to church, and she currently remains really well as well. So I was so pleased with that outcome, and we didn't do anything too complicated with her. And then my third case study is a 35-year-old female, BMI 19, so underweight. This is a current case that I've got at the moment, so it's quite complex. She came to me with extreme anxiety and panic disorder. She was having wasting, so muscle loss, fat loss, major GI issues, real difficulty with her bowel movements, brain fog, muscle aches and pain. Sleeping was all over the place, and she also had multiple vitamin and mineral deficiencies and reactivated pathogens. So we did a biome site, and we've done various other tests. We've done quite a lot of investigation here, but again, I wanted to highlight that there was nothing remarkable within her stool test, but again, low akkermansia, low bifido, low lactobacillus, and low some of the low short chain fatty acid producers. So this is ongoing intervention, but we've optimized nutrition and digestive function. So I've used things like liposomal supplements and liquid supplements and transdermal supplements because of the digestive function. It really just helps with the absorption of those specific nutrients. I'm using polyphenols, enzymes. We're using viral silencing support and intermittent fasting, and I've recommended also polyvagal interventions and cold water therapy. So at the moment, we're at good improvement. So we've got about 80% of sleep has improved. Pretty much all the GI symptoms are under control. Sleeping is okay, and now we're getting to a point where there are better days. There's more better days than bad days. So recovery is ongoing with that one, but it's still really encouraging that these interventions are showing good results. So with regards to overall interventions that I look at with my clients, so I presented on this in the 4th Long COVID Coalition, but it's looking at the same things with everyone really. In the case of we need to optimize digestion, we need to assess antioxidant and polyphenol and flavonoid status, because a lot of people with long haul COVID have got this excess oxygen, reactive oxygen species going on. Looking at identifying any nutritional deficiencies, so magnesium, B vitamins and iron tend to be the major players. I'm looking at optimizing proteins, fats and carbohydrates. I'm looking at color and diversity. So I'll look at taking things out like, the vegetable oils, the processed foods. We want to try and switch to organic where possible. And it's really just cleaning up the diet where we can. And those things in themselves can be really effective. And then, as I say, I look at adopting some stress management techniques. We're looking at reducing toxin exposure. I've talked about oral hygiene as well and the importance of that. And also just reiterating to people out there that there are solutions. There are some fantastic products on the market at the moment that are specifically targeting, these issues that we're seeing. And there's lots of medical doctors working in this space. There's lots of people like myself who now have quite a few years of experience working with these clients. So it's to know that even if you're feeling really scared and really vulnerable, it's to reach out to the positive people that can help to support with your recovery. So thank you so much for listening to my podcast today. And if anyone has any questions, I'm going to put my contact details up with the Long COVID Foundation, and please feel free to contact me.
Thank you very much, Rachel. That was really amazing presentation and really great case studies that you presented. It feels quite positive, to be honest. I'm always on a positive side that people can get better. They just need the right practitioner, the right nutritionist, and the right knowledge to put them on the right path of recovery. Thank you for doing this for long haulers. I'm sure they appreciate that you do that because they need support. Yeah. So in terms of my questions, you mentioned that Akkermansia is on the low levels. So what do you think is happening that it is at the low level in long COVID?
Well, you know, I kind of think about this bacteriophage issue that's going on, and I found a preprint study that I'm just waiting to have the time to really pick it apart. But we know, obviously, through the research that you guys have been doing and that you guys have been presenting, is that there is bacteriophage activity going on. And what's really interesting is that when you look at these microbiome panels, there isn't anything horrendous in the gut. It's the commensals that are being knocked down. And I wonder whether the bacteriophage activity is occurring within the Akkermansia species and the butyrate species and these lactobacillus and these bifido species particularly. And the study that I did find, the preprint, it actually did show that it was occurring in those particular species. So I think potentially that's something that's the hypothesis that I have at the moment. And it will be interesting to see when BiomeSite collate all their data as well, whether they're seeing a similar thing in all of the tests that are coming through in that particular study.
Absolutely. Because as far as I understand, Akkermansia is a keystone species, meaning that based on the levels of that particular species, you're going to have the rest of the species developing. It's very important. So how do you tackle, what are the main interventions to at least, try to increase the level of it?
Yeah, so I have been using polyphenol supplementation. I've been using medicinals 9 in some clients. I've been using dietary interventions, so ensuring that people get diversity of their fruits and vegetables, because all of those factors will help to feed and develop and grow and proliferate a healthy microbiome. The other thing that I look at doing as well is, because we need to think, I always think top down, and I think if someone's presenting with dysbiosis, okay, yes, there could be the bacteriophage issue going on, but it could be something happening in the oral cavity. It could be that digestive secretions aren't optimum. So we know if we don't produce enough stomach acid, or our stomach acid isn't acidic enough, that's not going to trigger enough bile. It's not going to trigger enough digestive enzyme output. So that's going to have an overall effect on the way that we digest and absorb our nutrients, but also how that then goes on to feed the gut microbiome. So yes, I address the factors relating to dysbiosis immediately through food, but I also look at optimizing oral hygiene, stomach acid production, bile flow, and digestive enzyme output as well. And all of those factors together, I think, has been the kind of thing that's helped with the overall success and recovery of some of my clients.
You've also mentioned in your cases that some of your patients had muscle pains. So this is actually something that we started to see in comments under our foundation, that people raise alarm why we're not discussing this issue. So in terms of microbiome, do you think the low level of Akkermansia could lead to pains in the muscles, or this is fungal infection or yeast or something that may trigger this pain?
It can be. What's really interesting is this is something that's been discussed in kind of chronic fatigue syndrome and fibromyalgia as well. And so you always would look to address the gut microbiome, and certainly things like fungal and almost parasitic infections can contribute to that, as well as dysbiosis. I don't think there is one particular bacterial species that does that, but I think there is issues in the sense of how the immune system is then communicating with the gut microbiome, and that can activate TLR4, toll-like receptor 4, which then can kind of create this cascade of inflammation, and then that can affect the mitochondrial function. And I think actually the link between the gut and the mitochondria is what's creating the pain and the inflammation and the muscle fatigue that people are experiencing. I think it's a lot deeper than perhaps just looking at the gut.
Oh, yes. So we also see that some patients, they gain weight during long COVID. Why does this happen?
So the one mechanism could be that there is a disruption to butyrate producers. So butyrate producers have been shown to be low. It's kind of like causes obesity. So a lot of people that present with obesity have low short chain fatty acid producers. So that's one mechanism. The other mechanism is that there just could be this disruption. There does seem to be a disruption in the way that people are handling glucose, and that could be related to intestinal hyperpermeability. It could be related to some of these bacteria not breaking down the carbohydrates as effectively, and so that's leading to kind of excess sugar being built up within the bloodstream, which again we know the effects then of insulin resistance and all of those other factors as well. I think stress plays into that as well. So if someone's in a heightened stress response, then that too, obviously that's going to have an insulin response as well, and it all kind of comes back and cross communicates with the gut microbiome as well.
So what people need to do then? Do they need to stop eating sugar, or I don't know, look into supplementation maybe? What is the best?
I think it's a mix of both. I find that intermittent fasting has been really helpful for people, just because that helps to trigger the healing from a cellular perspective. So that can also be really useful for stabilizing blood sugar levels. What I try to do, a lot of people tend to come with me if they've got GI issues, they're eating little and often throughout the day, and that's not helping. So it's about kind of trying to work out the circadian pattern of eating, which can help to stabilize blood sugar levels. You can look at things like reducing carbohydrates down. So doing more low carbohydrate diets. Some people are doing well on ketogenic diets, but in dysbiosis, I tend to avoid that a little bit. I like to address the gut first before doing any ketogenic type diets. But yeah, you can certainly look at strengthening the digestive tract. Digestive enzymes are really good as well, because they will help with the breakdown of proteins, fats, and carbohydrates. So there's a number, and it depends how everyone's presenting with, really. But as long as you can, look at your plate and think, okay, have I got a protein source? Have I got a carbohydrate? Have I got a fat? And have I got vegetables and fruits? I think you're pretty much on a good level.
Sure. So my last question is, at what point patients get to you?
Right at the end. I'm like the last resort. I'm like the last hope. So I find, especially now, we're 2 years into it now. And in a way, that's really good because they've been through a journey already. There's tests that have been done. There's all sorts of interventions that have been explored. So I can really take all of that information. And what I love the most is just putting the puzzle together and trying to unpick the root cause. And it works and it's helping, There are some complex cases out there. It's not a quick fix. And
Absolutely.
I think people are starting to realise now that actually it isn't a case of taking a supplement or a medication. There's actually a lot more to it. And I think where I fit in, as I said at the beginning, it's that foundation level.
Exactly. So how do you deal with patients when you have to say, oh, you need to take those supplements, and they're gonna, say, we already tried different supplements that didn't work. So how to communicate that not necessarily all supplements do good, and not necessarily that all these supplements that are good for health in one or another case are not good for individual in particular.
Yeah, it's really difficult because, of course, people have had to almost become educated themselves with all of this medical intervention and supplement intervention. And, people are now really highly educated on vitamins and minerals and pathways. People, I don't think people really understood guts and microbiomes and mitochondria. You can say that to lots of people in the general public now, and they know what you're talking about. So that's been really great because people are getting educated on how their body's working, but equally you can get stuck in dogma of this supplement does this, or this diet does this, or this intervention does this, and it's still not connecting that actually it's a personalized thing. And so sometimes I get people with this massive long list of supplements, but because they're anxious as well, they're frightened to give them up because they don't want to take a step back. So again, it's just about really carefully educating people, and I think that's where testing can come in really handy, because you can then show people you don't need this because your body's able to do this on its own, or you do need this one, and then you can really start to tailor it down, and that's how you get the trust. But yeah,
absolutely. Thank you, Rachel, for your time. It was great pleasure talking to you. And I hope people will take this video and share among their practitioners, among those who suffer, and help us raise awareness about this debilitating condition. Thank you, Rachel, for your time. And let's see how you get on with the rest of your cases, and hopefully speak to you in the future.
Yeah, I'd love to come back and present some more maybe in 6 months' time and see how people are doing.
Absolutely. Thank you, and goodbye.
Bye.